In the early 1990s, homelessness became a visible problem in Bradenton, Florida, with more and more people living on the streets. Concerned civic, religious, and private entities joined forces to respond to the need for an organization to focus on preventing and ending homelessness by founding the Community Coalition on Homelessness in 1995. The mission, which endures today, was to provide, facilitate, and coordinate services to people at risk of or actually experiencing homelessness, with the goal of preventing and ending it. Our response to homelessness issues has evolved as its face has radically changed. Services are now tailored to meet the needs of not only men, but also the growing number of women and children struggling with homelessness. In February of 2013, the name of the coalition was changed to Turning Points. Our new name reflects the impact of the organization and potential opportunities for clients to make big changes in their lives. The programs operated by Turning Points and those operated by partners in our one-stop center have a single goal: to end homelessness. We accomplish this by addressing client needs through on-site programming aimed at moving people towards stability and independence, as their mental and physical health allows. Turning Point's innovative approach integrates the provision of basic needs with programming that addresses physical, behavioral, and emotional needs, equipping clients with the most resources possible as they seek self-sufficiency. Although studies consistently show the cost-effectiveness of our programs, we continue to struggle with the negative stereotype of homelessness embraced by many. We need to raise awareness of our organization and the serious, critical impact we have in our community. The success of our center is dependent upon our ability to maintain the cooperation and support of our many community partners. Each day, approximately 80 volunteers, some who are supplied as paid staff by community partners, work in all aspects of program delivery at our center. More than half our total support and revenue is supplied by in-kind contributions of time and materials, significantly impacting our ability to leverage both public and private resources. We utilize a win-win model to recruit participation of more than a dozen agencies to provide services at our one-stop center. Turning Points develops services in direct response to the needs expressed by clients. By offering comprehensive services in a single location, we're able to address a multitude of issues clients face in one visit. This reduces the fragmentation and frustration clients often experience with traditional service delivery, which focuses on one aspect of their situation at a time. While each client typically has a unique path that has led them into homelessness, there are common elements to many of their stories which can be addressed in just one visit. Turning Points measures success for each direct service program operating in our one-stop center. Evaluation is conducted on a continuous basis in two ways. First, we utilize statistical data collected from all our programs and enter it into a homeless management information system database. This provides monthly reports or snapshots of the progress of each program in meeting its goals. Second, our client survey tool gathers data on unmet needs and service delivery satisfaction. The general public is often unaware of the reality of the changing face of homelessness. In 2004, our statistics reveal it was primarily men seeking day resource assistance, while now the number of women is almost equal. Families represent the fastest growing segment of the homeless population, a fact demonstrated by the more than 2,000 homeless children in our county each year. We are not a shelter and don't have housing of our own. Instead, we work closely with landlords and other agencies to advocate for more low-income housing options for our clients. Turning Points brought together city, civic, county, and state institutions to implement our shared vision of a comprehensive resource center, which now serves more than 8,400 people annually. And we're already debt-free, even after completing this $3.8 million facility. Development and implementation of a medical and dental program has enabled us to recruit new partners in the fight against homelessness. Effectively leveraging these partnerships enables on-site primary, preventive, and pharmaceutical care. Each and every day that we open our doors, we serve more than 200 adults in search of assistance, enabling them to get basic needs met, things many take for granted, but people in need find are priceless. The stigma associated with homelessness impacts our ability to raise funds and also prevents people on the verge of homelessness from seeking assistance. We recognize the need to raise awareness of the reality of homelessness and its impact on our community, but struggle with designating funds for marketing when there's such a great unmet need for direct services. Competing with other organizations for dwindling public and private support is a reality that Turning Points is addressing as we develop both short-term and long-term strategic operating plans. Focusing on maintaining our core programs is the primary objective of Turning Points. Additional resources could develop organizational capacity to ensure our current critical programs are operated efficiently and effectively. The need for committed, qualified, and trained volunteers exploded with the development of our one-stop center. We need to make permanent the volunteer coordinator position in our workforce. Additionally, our marketing and development activities are currently handled by all staff as part of their other duties as necessary. A staff member dedicated to marketing and developing support for the programs of Turning Points would raise awareness of the reality about homelessness, as well as develop financial support for our critical programs. Dealing with the lack of coordination between groups that provide services to the same target population is a common concern to agencies and funders. We can address this issue by coordinating the development of a common assessment tool that could be utilized by all homeless service providers entering data in the common Homeless Management Information Database. With your assistance, we can do this and enable clients to realize their goal of self-sufficiency.